Hello, everyone, and welcome. We will get started in just a few moments here. We're going to give folks a chance to get on and get their audio set. Hello, everyone, and welcome. As you are jumping on, please feel free to introduce yourself via the chat so that we can network and get to know each other. We will get started in just about 10 seconds. All right, good afternoon, and welcome to the Indiana Youth Institute's webinar, the 2026 State of the Child. My name is Joshua Long. I am the Senior Educational Content Manager here at the Indiana Youth Institute, and we thank you for joining us today. We are grateful to have a chance as a community of Indiana youth workers who remain committed to meeting the needs of our youth and children. For those who are not familiar with IYI, our mission is to improve the lives of all Indiana children by strengthening and connecting the people, organizations, and communities that are focused on kids and youth. Listed here, you can see our vision that drives the work we do for Indiana youth. And now, before I begin, I'd like to share a few pointers that will help you engage with today's webinar. For any technical support issues, use the chat feature to send a message, and I or an IYI team member will assist you. Use this feature to converse with the group as well. We also encourage you to ask questions, so please use the Q&A feature for any you may have, and we will get to as many as possible. Feel free to upvote the great questions to the top so that we can see them. Later today, you will receive an email with a link to complete an evaluation of this webinar as well as the presentation slides. Please take a few minutes to let us know your thoughts about today's presentation, and if you don't receive the eval email, please check your junk as it may have been directed there. Once you complete the evaluation, you will be redirected to your certificate of participation. Like all of IYI's webinars, today's webinar will be posted on our website if you'd like to revisit a portion later or share the opportunity to listen in with partners. And with that, it is my pleasure to turn it over to our speaker for today, Dr. Sherri Lauver, who is the Vice President of Data, Research, and Professional Education here at the Indiana Youth Institute.
All right, thank you so much, Josh, for that welcome. Good afternoon, everybody. Thank you so much for being here on what is a warm and sunny day out my window. So thank you in particular for being here on a day just like this one. Welcome to our 10th annual State of the Child webinar. As Josh said, I'm Sherri Lauver, and I'm joined by Youn, and she is our Kids Count Data and Research Program Manager. And she's pretty famous for the work that she does. It's very, very hard work, and I'm thrilled to be able to share it with you today. As Josh mentioned, take a minute, introduce yourself and your organization in the chat box. We'd love to know more about you. Throughout today's presentation, we're going to walk through highlights from this 2026 Indiana Kids Count Data Book with a particular focus on health and education today. You'll hear a lot of good news. You'll hear areas where progress has stalled. And what makes this year's data particularly important is that we're now several years removed from the acute disruptions of the pandemic. We're no longer looking at shock responses anymore. We can now tell what's steady again, what's recovered, and what's still struggling. So feel free to drop questions into the Q&A. Bree, who knows the answers, is happy to respond to you as we go. She'll be doing her best to catch all of them. If she misses something, we can certainly catch up with you at the end and answer that question. And as you listen today, think about what stands out most for you and where we need to make improvement in the state of Indiana this next year. Okay, now Josh shared with you our mission, so I'm just going to move right along to the next slide and introduce our data book. For the past 32 years, IYI has released the Indiana Kids Count Data Book as the state affiliate of the Annie E. Casey Foundation's Kids Count Network. And that's one of 53 of them actually across the country. The Kids Count Data Book serves as more than just a collection of statistics. It's a report card for us as adults. It challenges us to understand where we are making progress and where we need to do better. but that means we need your help to make sense of the information and then, of course, to act on it. A special note today, due to some data delays, particularly with the release of the census data on January 29th, our data book has been updated for health and education, but not yet for economic well-being and family and community. We will be releasing a second version later this spring with all of the data updated for 2026. Now, I want to tell you a little bit about 5 by 50 in case you haven't heard of it before. Um, at IYI, we believe that every child deserves a strong network of caring and supportive adults. And that belief is the heart of our 5 by 50 initiative, a statewide vision to ensure that every child in Indiana has at least 5 supportive adults in their life by the year 2050. And those adults could look different from child to child. They could be a youth worker, a school counselor, a coach, a mentor, a nurse, a pastor, or an after-school program leader. So it doesn't matter what the title is, it's about the relationships. And as we move through the data today, I'm going to keep coming back to this question, like, where are our connections strong and where are kids falling through the gaps? So just keep thinking about how important relationships are in strengthening our children. When we talk about health and education, what we're really talking about is whether kids have consistent, trusted adults showing up for them. So with that framing in mind, let's begin with how Indiana stands compared to some other states. So these are our overall rankings. The Annie Casey Foundation leads this National Kids Count initiative. We serve as Indiana's partner. For the 2026 data book, Indiana ranks 25th overall for child well-being. That's an improvement over where we were several years ago, but we've been hovering in the mid-20s for a while. So we're steady, we're just not quite breaking into that top tier, but I have faith in us. Our strongest gains have been in economic well-being and education, where we've climbed into 11th place, and that is something to celebrate. That shows that progress is possible. But health and family and community continue to pull our overall ranking down. What that tells me is this: we can move outcomes when we focus, but progress isn't automatic over these domains. A child doesn't experience health, education, or family stability in isolation, and neither do the solutions. So let's kick it off with family and community. So when we talk about family and community, one of the core domains by which we group our data, we're looking at the structures surrounding our children, who is caring for them, how stable those environments are, and whether young people are interacting with formal systems. And I hope you'll visit the data book and look back at this section. I'm going to jump right back into teen birth rate, one of the first areas of this section. Indiana's teen birth rate continues its long-term decline, and that is great news. So we look at this chart, in 2022, the teen birth rate for teenagers age 15 to 19 was 16.7 per thousand. Now that's down from 17 per thousand in 2021. So what does that actually mean? That translates to 3,743 infants born to mothers ages 15 to 19 that year, compared to 3,845 in 2021 and over 4,000 in 2020. So teen births accounted for 4.7% of the total number of births in 2022, and that's down from 5.3% in 2020. So over a longer horizon, the trend is even more clear. In 2015, Indiana's teen birth rate was 22.3 per thousand, so it has now declined to 16.7. At the same time, if we're looking at national rates, which is the gray line on this chart, it was 13.5 per 1,000. So Indiana ranks 14th highest among states. So while we continue to make progress and we see sustained improvement, Indiana remains above the national average in this area. Next, let's talk about grandparent caregiving. In 2023, 41.6% of Hoosier grandparents living with their grandchildren were responsible for their care, and that was compared to 32% nationally. So the yellow bars here are represent our Indiana grandparents. That rate declined slightly, over the past period of time. And among our grandparent caregivers, 56% were between the ages of 30 and 59, 44% were ages 60 or older, 60% of them are in the labor force, and their median household income was $68,000. At the same time, about 28% of children in these households lived in renter occupied housing, and 42% received cash assistance, SSI, or SNAP. So this continues to reflect the critical role that extended family networks are playing in stabilizing children's lives. And we'll do a little deeper dive into rent and mortgage later on in this presentation. Next, I'd like to look at juvenile admissions. So between 2022 and 2023, juvenile new admissions increased from 346 to 497, representing a 43.6% increase in 1 year. So in 2024, that number declined just slightly to 495 new admissions, suggesting that there is a leveling off after that sharp increase the prior year. Looking at the population snapshot in January 2024, 63.6% of incarcerated juveniles were held for level 1 violent offenses, and that's up from the prior year. In January 2025, that share declined to 57%. So we've seen a shift in the composition of offenses after last year's spike. Now, gender distribution remains heavily male. You don't see that here. But what we know and what's in our data book is that 87% of incarcerated juveniles are male. That was in 2024. By 2025, it was down to about 85% of the population, but still representing the overwhelming majority. And the average age at intake remains pretty stable. It's about 16 years, both in 2024 and 2025. So that reinforces that system involvement continues to concentrate in that mid to late adolescent stage. So overall admissions have stabilized and the share of level 1 violent offenses has decreased from its peak. Next, juvenile releases. So when we shift from admissions to recidivism, the data become far more complex. So take a look at that data book for a more in-depth explanation of what we can provide in the findings here. Among juveniles released in 2021, nearly 1 in 3, or about 32%, returned to incarceration. And that is up from 25% reported the prior year. In addition, 57% of juveniles released in 2021 were charged with a new crime, up from 51%. And weapons were the highest offense category at 50%. And that is a substantial increase from 15% the prior year. Recidivism rates differ by gender. Again, we don't share that on our slide, but we know that 35% of male juveniles return to incarceration compared to 15% of female juveniles, consistent with prior patterns. Severity level also does matter. Juveniles classified as severity 2 had a 33% recidivism rate, aligning with prior year trends. Age at release continues to play a role. The younger the juvenile at the time of release, the more likely they are to return to incarceration. So the younger they are at the time of their release, the more likely they are to return to incarceration. And there's a really interesting pattern here. So among juveniles who were released in 2021, if they were incarcerated less than a year, they had a 31% recidivism rate. If they were incarcerated between 1 and 2 years, it was almost 35%. If they were incarcerated between 2 and 3 years, it was a rate of 36.8%. And that is a decrease from 50% the prior year. So while new admissions have leveled slightly from their peak in 2023, recidivism indicators show upward movement in several categories, which is worrisome, particularly among males, younger juveniles, and those with certain severity classifications. Next, we're going to turn to health. So family structure and system involvement shape children's environments, and health data shows us how those environments translate into outcomes. And those begin before birth, and they continue through adolescence and beyond. Health spans infancy through adolescence, and it reflects both our access to care and then also our lived experience. And we're going to start with infant mortality. We're lucky to have, a decade's worth of data here. So infant mortality reflects not just what happens in that hospital delivery room, but the conditions that surround a pregnancy, maternal health, access to prenatal care, housing stability, nutrition, and chronic stress. Here, Indiana is represented by the blue line across these 10 years. Infant mortality rate declined to 6.6 deaths per 1,000 live births in 2023, and that's down from 7.2 in 2022. So this is the second consecutive year of improvement. There were 523 infant deaths in 2023, compared to 564 in 2022. To give you some context, the national rate was 5.6 per 1,000, meaning that Indiana remains above the US average. Among Black infants in Indiana, the mortality rate was 13.8 per 1,000 live births, compared to that 5.2. So while the direction is positive, disparities remain significant, and the gap between Indiana and the national average does remain meaningful. Next, we're going to look at low birth weight, which is another early life indicator that carries long-term implications. In 2023, 8% of Indiana infants were born with low birth weight. So that's about 1 in every 12 infants. This rate has remained pretty stable in recent years, but low birth weight does extend and increase the likelihood of extended hospital stays, developmental delays, and chronic health conditions later in childhood. So the fact that the rate has not increased is certainly positive, but we are seeing stability rather than improvement right now. Moving on to vaccinations. Infant vaccination coverage is moving in a positive direction right now. In 2024, 62% of Indiana infants ages 19 to 35 months completed the full recommended vaccination series. And that's up from about 59% in 2023. So it's actually a 3.1 percentage point increase year over year. And this is encouraging. It suggests improvement in access to preventive care. However, what that also means, and I'm sure you're computing this yourself, is that nearly 4 in 10 infants are still not fully vaccinated by their second birthday. And that highlights a continued opportunity for outreach, for provider engagement, and family support. Next is children insured. Tracking children's health insurance coverage allows us to understand whether children are connected to the healthcare system. And that connection does obviously mean something then for vaccination. So most Indiana children are insured, but the uninsured rate remains slightly above the national average. So in 2023, 95% of Indiana children had health insurance coverage, but that left over 100,000 children, or about 6%, uninsured, higher than the national uninsured rate, which is about 5.4%. Interestingly, children with disabilities do have higher overall coverage, but they rely heavily on public insurance. So in 2023, again, a little over 95% of Indiana children with a known disability were insured, and that's slightly below the national rate of 96%, and 64% of those were covered by public insurance, compared to 62% nationally. So we're, about 2/3 for both. Coverage stability is strong, but it still trails the US overall. And finally, affordability and adequacy remain a concern for many families. So nearly 30% of caregivers report that their child's insurance is not adequate to meet their needs. And 17.7% report out-of-pocket costs at $1,000 or more, which is higher than the national rate of 16%. So to sum it up, most children in the state are insured through a combination of Medicaid, CHIP, and private coverage. And this is significant because insurance coverage is strongly associated with preventive care, early diagnosis, and improved long-term outcomes. Coverage alone does not guarantee access, and that brings us to provider capacity and access. Insurance coverage is just one piece of the puzzle. Provider availability and accessibility is another. So first, let's talk about mental health providers. The ratio is approximately 474 to 1, meaning there is one mental health provider for every 474 residents. Indiana's primary care physician ratio stands at roughly 1,510 to 1, and the dentist provider ratio is approximately 1,650 to 1. All three ratios improved from the prior year, and I'm happy to report that. When a provider ratio improves, it means that there are now more providers available relative to the population. And this can translate into shorter wait times, greater geographic access, and earlier intervention. Mental health providers play a critical role in supporting our children and adolescents. They provide assessment, therapy, crisis intervention, and ongoing treatment for conditions like anxiety, depression, and trauma-related disorders. Primary care providers do their part too. They are our entry point into the healthcare system. They handle routine visits, preventive screenings, immunizations, and referrals to specialists. They're often the first line of identification for developmental delays, behavioral health concerns, and chronic conditions. And then oral health is another essential and often overlooked component of overall health. Dental care is not just about cavities. It's actually closely connected to nutrition, speech development, school attendance, and overall well-being. When dental access is limited, preventive care declines and more serious oral health issues may go untreated. So taken together, we're seeing some improvement across all three provider ratios. That shows us some progress in strengthening healthcare access across Indiana. While shortages remain in certain regions, the overall direction is positive. Student-reported mental health. As children enter adolescence, mental health becomes a central focus. So, according to the Indiana Youth Survey in 2022, 36% of students reported feeling so sad or hopeless for 2 or more consecutive weeks that they stopped their usual activities. But in 2024, that number declined to 30%. So we are seeing an almost 6-point drop, and that represents measurable improvement in this area. Similarly, students seriously considering suicide did decline from 17 to 14%, and students making a suicide plan declined from 12.8 to 10.1%. These are meaningful shifts. They do suggest that preventive efforts, school-based support, and increased awareness may be contributing to improvement in reported symptoms. Survey data are only part of the picture, however. So let's move into youth suicides. So while student-reported symptoms of sadness have declined, our mortality data tell a more sobering part of our story. In 2023, 152 Indiana youth ages 10 to 24 died by suicide. And you can see the breakdown across age groups. So 65 were youth between the ages of 10 and 19. Suicide remains one of the top 3 causes of death for young people in Indiana and has held that position for over a decade, as far as we can look back in our data books. That tells us something very important. Even as fewer students report persistent sadness or suicidal ideation in surveys, the most severe outcomes remain elevated. The data suggests that while prevention and awareness efforts are indeed reaching youth, there are still young people in crisis at a level that results in this kind of tragic outcome. So this reinforces our need for mental health first aid programs, early identification, building those protective relationships, that 5 by 50, and timely access to care. Suicide remains a leading cause of death. Next, student reported substance abuse. We are seeing some overall good news here, but some words of caution. Substance use trends are in a long-term decline. So we're seeing declines across the board in alcohol use, cigarette use, vaping declines, and marijuana use declines. And you can see the numbers on the charts here. And these are not short-term drops. They continue a decades-long trend. So overall, fewer young people are engaging in traditional substance use behaviors. This is great news. However, overdose deaths among youth ages 15 to 19 did increase by 5%, and opioid-related deaths increased by 8%, reinforcing that we have concerns in those areas. Now we're going to move on to economic well-being. So when we look across the health domain, we see progress, we see pressure. We see declining infant mortality, and we see improved student-reported mental health. We see persistent low birth weight rates, ongoing suicide burden, high insurance coverage, but still some provider shortages. Health outcomes are shaped by our economic conditions. And what we mean by economic conditions, we're talking about children living in poverty, housing stability, food access, financial security. So let's talk about that right now. Children living in poverty. The data shows that child poverty has reached its lowest level in over a decade, and that signals progress. So that's progress relative to our historic levels, even as economic stress indicators like food insecurity have moved upward. Child poverty has, reached its lowest level, and we are seeing some improvement compared to historic highs. So when we look across some of our states, it's right there with our other states in our Midwest region. Sorry about that, Bree. Next, let's look at food insecurity. So this is where we've seen one of our sharpest shifts. So in 2021, about 13% of Indiana children were food insecure. In 2022, that number rose by about 5% to 18%. That's actually a 39.5% increase in 1 year. So what does that mean in terms of the number of kids? That's over 285,000 children in Indiana who are food insecure. Of those children, 30% of those children are likely ineligible for federal nutrition programs, meaning that their parents, their families earn too much to qualify for assistance, but they still struggle to consistently afford food. Additionally, another 31% of households report that while they can afford enough food, it's not nutritious. And that's higher than the national rate of 27%. So these are not subtle increases here. We're seeing real financial strain in food insecurity. Now, in terms of housing costs, housing represents a different pattern, one of persistence rather than sudden change. So for homeowners, that percentage that pays 30% or more of their income towards mortgage costs declined slightly, just from like 20.3% from 2014 to 2018 to about 19.5% in 2019 to 23. So we're seeing slight changes. For renters, however, the burden remains a lot higher. The share of renters paying 30% or more of income toward housing costs remains essentially unchanged, and that's at 47.5%. So nearly half of renter households with children feel cost burdened. This tells us that rental burden remains kind of an entrenched, problem, particularly for families without home equity. So stable does not necessarily mean manageable. Finally, I'm going to turn to education. We are seeing more good news here, and I'm really happy to share this with you. Last, education is where many of our domains converge. Family stability influences attendance, health affects student engagement and readiness, economic strain shapes persistence. So our education domain allows us to see how students are truly progressing from early literacy through high school completion, and then on to whatever post-secondary pathway they choose. So first, we wanted to talk about our teachers. So right now, this chart compares the demographic composition of Indiana's teacher and student populations by gender and race ethnicity. So overall, the teacher workforce is predominantly white at 81% and female at 57%. In contrast, our student population is much more diverse. We have 62% of our students are white, 49% are female, with a slight majority male. Students have substantially higher representation than teachers among several racial and ethnic groups. So Black students make up about 13% of the student population, and that's compared to 4% of teachers. Hispanic students represent 15% of students, but only 2% of teachers. Asian students at 3.2% and multiracial students at 5.5% are also more represented than their teacher counterparts. American Indian and Native Hawaiian and other Pacific Islander populations are small in both groups. The chart highlights a notable demographic gap between Indiana's largely white teaching workforce and its increasingly diverse student population. I also want to briefly mention here teacher retention, which is included in our data book. Teacher retention is one of the clearest indicators of school system stability. So Indiana's teacher retention rate declined from 87% to about 81.5% in a single year. And that's one of the sharpest year-over-year drops that we've seen in recent cycles. That 81.6% retention rate means nearly 1 in 5 educators do not return to their position the following year. Stable staffing matters because instructional continuity influences student performance, classroom culture, and then ultimately students' long-term academic growth. Retention doesn't always make the headlines, but it shapes everything else in this domain. When teacher retention stabilizes, it creates the kinds of conditions that we need for academic enrichment and support. Next, we're going to take a look at chronic absence, something that's been in the news media now for several years in Indiana. Chronic absence is one of the strongest predictors of academic risk. It is defined as missing 10% or more of the school year. And it increased sharply during the pandemic, as many of you probably know. Chronic absenteeism declined from 18.3% to 16.8% in the past year. And that is a second consecutive year of improvement. So that's good news. Recent data shows improvement from peak levels. You can see that 21% in 2022, but rates remain elevated compared to pre-pandemic benchmarks. So if you look way back to 2019, you can see it was at 11%. Attendance recovery has been gradual, but students are back in classrooms and consistent attendance matters. We are seeing improvement, but we're not yet seeing full normalization. Next, let's take a look at our iRead proficiency scores by group. Third grade reading proficiency continues to improve. And the iRead, that indicator, measures whether students are reading proficiently by the end of third grade. And that's a key milestone in their student performance and their long-term academic success. So compared to the previous year, proficiency rates increased, and that signals continued recovery in foundational literacy. Indiana's iRead 3 proficiency rate rose to 87.3% in 2025. That's up from 82.5% the previous year. So that increase helps us fully return the state to those pre-pandemic levels, and it matches the high in 2019. So while scores remain slightly below our pre-pandemic benchmark, that upward movement reflects steady academic rebuilding. So in practical terms, more third graders are meeting proficiency standards today than in the immediate post-pandemic years. And reading proficiency at this stage predicts performance across all subjects in later grades. So it's incredibly important and makes this upward trend particularly so. iLearn scores in both English language arts and math also show continued upward movement. Happy to report this. 40.6% of students were proficient in English language arts, remaining relatively flat from the prior year, and 42.1% were proficient in math, and that's a modest improvement from the prior year. So following our pandemic era learning disruptions, academic performance has been steadily improving. Math recovery nationally has lagged behind reading in many states, so any upward movement in iLearn math scores is particularly notable. And while proficiency levels have not fully returned to the pre-pandemic benchmarks, the direction of change is positive, and academic stabilization is ongoing, and good news. The SAT is next. The SAT provides insight into college readiness and also post-secondary preparation. Participation and performance trends help contextualize our enrollment patterns, which we'll talk about later. SAT outcomes reflect both academic mastery and student participation in post-secondary pathways. So in 2025, 54.5% of students met the SAT benchmark in evidence-based reading and writing, and that is a substantial increase from 38.8% the prior year, a very strong gain. But only 25.4% met the SAT math benchmark. So in other words, roughly 1 in 4 students is meeting college readiness expectations in math. So academic progress is happening, but it's uneven. Literacy is strengthening, and math remains an area of concern. Okay, next we're going to look at graduation and dropout. Again, great news here. Indiana's graduation rate reached a historic high. Indiana's high school graduation increased to 90.2%, and that's up from 89% the year before. This means that more students are staying on track and earning diplomas on time. This also represents continued strengthening of high school completion. Graduation rates reflect not just academic achievement, but that persistence and engagement and successful navigation of all of the graduation requirements. Most students are completing high school and more than at any point in the state's histories. So at the same time, the dropout rate declined from 6.6% in 2023 to 5.8% in 2024. So that less than 1% point decrease does reinforce the upward movement in graduation. Dropout rates remain lower than pre-pandemic levels, indicating stronger student persistence. And then when the dropout rate declines and graduation rises simultaneously, it signals improved retention across all high school years. We're getting close to the end now, and we're going to take a look at college enrollment. Post-secondary enrollment remains relatively steady, For the class of 2022, about 53% enrolled in college, and that was largely the same the prior year. So this near flat trend suggests that while high school completion is improving, post-secondary enrollment has not accelerated at the same pace. Enrollment remains below pre-pandemic highs, indicating that the transition beyond high school continues to stabilize rather than expand. So graduation gains are clear. Post-secondary expansion is not yet. So our broader story this year is that Indiana is improving at getting students to graduation. Great news. The challenge now is ensuring that graduation translates into those next opportunities, that students have clear supported pathways into college, credentials, apprenticeships, or careers. Okay, so we're going to sum it up for you. I know that was a lot to take in. Remember that data book is available for you. So let me just provide a brief summary. So overall, Indiana improved from 27th to 25th in the nation in the overall rankings. We also improved from 15th to 11th for economic well-being, and we went from 17th to 11th, almost the top 10 in the nation, for education. They might sound minor, but not to the people who are working hard with children like you. They're a big deal for the children affected. Here in Indiana, juvenile admissions are down, and so is the high school dropout rate. The number of children whose parents lack secure employment has also fallen, and the median family income for households with children is the highest it's ever been. The teen pregnancy rate is the lowest in over a decade. Health insurance coverage remains near a record high level. And we've also seen real improvement when it comes to ratios of healthcare providers, including primary care physicians and school nurses. Still, there's more. When it comes to education, chronic absenteeism is down, reading and math scores are going up. I read 3 proficiency reached 87% last year. That matches our highest rate ever. And every student group showed year-over-year improvement, which signals a statewide momentum in early literacy. These gains are the direct result of dedicated professionals working to serve our students. And that's encouraging. I learned math and ELA still need to catch up a bit to where they were in 2019. But our SAT evidence-based reading and writing attainment rose last year, and that's another encouraging sign. In 2025, the graduation rate in Indiana was over 91%. That's the highest rate in the history of our state, and life-changing for students who got to walk across that stage. Okay, so just wanted to remind you that we do have county level data. The county level data has not yet been updated. It will be updated this spring, and we will send out an alert to all of you when that data is available. But for now, you have access to last year's data. As we analyze and report out on our census data, we'll be able to update this very, very quickly. So excited to share that with you soon. And also excited to share with you some of our upcoming local events. So Bree and I and others at IYI are traveling the state, and we're going to bring data directly to our local leaders. So each of these events is an opportunity to move beyond the statewide averages and focus on what the numbers mean for you in your county and community. Our goal is honestly just simple. We want to equip all of our partners with clear, actionable data so that they can strengthen our systems and relationships that support kids. So if you're interested in hosting or attending, you can scan the QR code to register and learn more. Okay. Thank you again so much for joining us today. We've included QR codes here so that you can download the Kids Count Data Book and join our 5x50 vision. I'll warn you, the Kids Count Data Book it's a big one. It's like 160 70 some pages. So I don't know if it'll actually download on your phone. You may have to go to your computer for that one. We have a link to our feedback survey, which is going to be placed in the chat. We hope that you'll take a few minutes to complete it. And as always, feedback is a gift. We closely review all feedback. We use it to improve. So on behalf of the IYI team, thank you so much for your attention. And now we're open for questions.
Bree, were there any questions in the chat or in the Q&A function that needed to be addressed?
I did them as we went. We are up to date on. And then, Sarah, I just dropped the link for all of the events as well.
Great. Great. Okay, so Sherri, if you're comfortable, we can go ahead and start closing out if there are no more questions. As always, if you do have questions as you're watching it, feel free to reach out to us. But as we close, I first want to just thank Dr. Lauver and Bree. The State of the Child is it is a big project that we do every year, and so just wanted to thank them for that and thank them for doing this presentation today. I'm going to pivot just a little bit to talk about some events that we have coming up. The first is our National Summit on Youth Wellbeing, scheduled for May 5th, 2026. It's our second year doing this, and it is virtual, so please look into that. Registration is open. And then next week, we have a webinar, How Families, Youth Orgs, and Schools Can Partner in College Readiness. So please take a moment to sign up for that. And then as we are concluding here, I want to also thank you all for being here with us. We appreciate your impact, your voice, and your choice to learn and partner with the Indiana Youth Institute. This afternoon, you will receive an email that will include a copy of the presentation and a link to complete an evaluation of this webinar. Please take a few minutes to let us know what you thought about the presentation today, and upon completion, you will be redirected to your certificate of completion. If you don't receive the evaluation email, check your junk as it may have been directed there. And so with that, we are going to conclude our presentation. So thank you once again for showing up today and every day for Indiana's youth.
Thank you.